Throughout middle childhood, children and families transition through a number of changes. Although several of these changes may be considered normative trajectories, it is important to acknowledge that several individual children and families may experience a range of adversities during middle childhood as well. Those who adjust and adapt to adversity are those who go through a process known as resilience. Researchers define resilience as a dynamic process encompassing positive adaptation within the context of significant adversity. When discussing resilience, researchers also commonly consider risk factors. A family and youth that are considered at risk are those that face a significant level of chronic or acute stress that threatens their capacity to function well over time.
Family system theory studies components that targeted parenting skills, family functioning, parenting styles, family patterns, or approaches that includes family. The family system theory relates to the body of literature regarding risks and resilience because the decisions, actions that are shown and used in their family could cause children to face risks factors such as obesity, bullying, homelessness, and being placed in an institution or foster care. Ecological system theory studies the human development and different types of environment systems that influence the process.
Obesity is defined as weighing more than 20% over one's ideal weight based on height, sex, and body composition. Childhood obesity has doubled in the past 30 years. According to the Center of Disease Control and Prevention, nearly 1 in 3 children in America are overweight or obese. The percentage regarding those children in the U.S. has increased from 7% to nearly 18%. Obesity causes social problems for middle-aged children. Some researchers have concluded that obesity is the most stigmatizing and least socially acceptable condition in childhood. Some problems that children who are overweight face is lack of social acceptance from their peers, bullying, and anxiety. Some strategies to ending childhood obesity is for parents to be more involved of what their children are eating. They need to create a healthy life plan where everyone is involved in, take time to exercise with their children, and cook healthy meals together. Teachers should include some physical time in their lesson plans, and community centers should offer health classes and support active learning.
Bullying is defined as repeated interpersonal behavior which is intended to do physical or psychological harm. Typically between children with unequal power can lead to other negative outcomes for both the bully and the victim. Bullying itself can take different forms: physical, hostile teasing, or emotional bullying, and even harassment over the internet. According to studies in both the U.S. and other countries, children who are bullied by their peers are more lonely and unhappy, have greater difficulty making friends, have more health problems, and show more internalizing behaviors such as anxiety and depression. Parent and child attachment has been found beneficial. In one of the articles, it was mentioned that secure children were rated by mothers and teachers as less excluded by peers than avoided and disorganized children, showing us that children who were securely attached to their parents tend to be able to have more successful interaction with their peers. There are many risk factors that come from bullying in middle childhood, some of which include depression, social anxiety, loneliness, isolation, stress-related health problems, low self-esteem, academic problems, aggressive behaviors, contemplating, attempting, or even committing suicide. Also, some dangers that those who are bullies face are delinquency, substance abuse, academic problems, and even an increased school dropout rate.
According to the United Nations, homelessness is not simply a lack of permanent housing. It is a cruel mix of human deprivation in knowledge, health, dignity, and rights, obstacles to participation, and lack of voice. Both the United States Department of Education and the 2013 U.S. Census data propose that there are 2.5 million homeless children. Homelessness accounts for 1 in every 30 children in the United States. Half of homeless youth have problems with anxiety, depression, or withdrawal, compared to 18% of other school-aged children. 36% demonstrate delinquent or aggressive behavior, compared with 17% of other school-aged children. The stress of homelessness in children can lead to insecure attachments to others, poor self-esteem, and dysfunctional personality development. In order for children to overcome such adversities as homelessness, they must learn resilience. Ways to foster resilience in homeless children include mentorship programs such as Big Brothers Big Sisters, school curricula designed to foster self-regulatory skills, interventions focused on increasing parent warmth and sensitivity, and improving schools in low-income areas.
A large amount of research has concentrated on the effects of deprivation on children due to institutionalization. However, very few studies have focused on the outcomes that early social deprivation potentially has on later social behavior and development in middle childhood. It is important to examine and understand not only immediate effects of institutional rearing and foster care placement, but also latent effects as well. Poor social skills during middle childhood may lead to social exclusion, which could potentially lead to adolescent risk-taking, which then may lead to difficult adjustment in later adulthood. Middle childhood is a crucial time of development within several domains for children, which is why the implementation of prevention and intervention strategies is extremely relevant. Several researchers have aimed to study the differences that may exist in regards to cognitive, social, and emotional development between children who have experienced institutional rearing, children who have experienced foster care placement, and for children who have not experienced either. Researchers agree on three major findings. Finding 1. Institutionalized children are less socially competent compared to foster care children. Finding 2. Institutionalized children are more reserved during interactions with peers compared to foster care children. Finding 3. Institutionalized children show deficits in emotion processing compared to foster care children.
Obesity, homelessness, bullying, and institutionalization are all critical risk factors that can predict the mental, physical, and social health of children. When any combination of these risk factors or other risks are identified in children, it is important to foster resiliency. There are many ways to foster resiliency in children, including developmental parenting, play therapy, and talk therapy, depending on the status and condition of the child. Developmental parenting encompasses a set of parenting practices meant to be developmentally appropriate and adjusted as children's needs and skills change. There are 4 key components to developmental parenting. They are affection, responsiveness, encouragement, and teaching. Play therapy is the use of play to engage with emotional, physical, or mental trauma. The reason why it is so effective is that it allows children to determine the outcomes and circumstances of the actions that they choose to perform. Son Smith in 2003 proposed that during play, children can experience primary emotions without losing control. Within the context of play, children can mediate their emotions and experience effective self-regulation of attention, arousal, emotion, and acting out behaviors. For many years, talk therapy has been used to help with emotional and psychological trauma. Talk therapy was always assumed to be an effective way to reduce risk and promote resiliency. The statement is correct, but the real question is, for how long? Unfortunately, the effects of talk therapy are very short-lived and disappear after 3 months of therapy if the sessions are discontinued. Risk and resiliency, the key points. Risk are any factors that can make children and families more vulnerable to poor mental, physical, and social health. Common factors that were previously mentioned are obesity, bullying, homelessness, and institutionalization. Resiliency is the human capacity to face, overcome, and ultimately be strengthened by life's adversities and challenges.